Hi, this is Chelsea Dale, and I'm going to be discussing the quality improvement model called FADE. Quality improvement is extremely important to your practice. Quality improvement benefits your practice in a variety of ways. It allows you to participate in reporting public data for others to see. This is useful as it allows other practices to emulate similar processes that you have already implemented and seen a positive change with. Another benefit to quality improvement projects is it can go towards merit increases based on 4 different categories. The merit-based incentive payment system tracks different categories such as quality, cost, promoting interoperability, and improvement activities. Your performance in these categories goes towards a merit increase. Final scores above the threshold will receive a positive payment adjustment. Scores below the threshold will receive a negative payment adjustment. According to the Academy of American Family Providers, exceptional performers that meet the additional performance threshold could receive an additional sliding scale positive payment adjustment of up to 10%. Quality improvement can also help your practice be recognized for things like the National Committee for Quality Assurances, diabetes, heart, stroke, and patient-centered medical home recognition programs. According to the U.S. Department of Health and Human Services, Health Resources and Service Administration, more benefits include improved patient health outcomes that involve both process outcomes and health outcomes. A culture of improvement frequently develops in an organization that is committed to quality because errors are reported and addressed. And finally, a commitment to quality shines a positive light on an organization, which may result in an increase of partnership and funding opportunities. Before taking on a quality improvement project, certain things need to be done. Coworkers need to understand why we're doing the quality improvement project, and also how their participation and positive attitude can play a role in this project. There may be some barriers to your QI project that you need to be aware of. You need to take a close look at your patients, patient load, chronic conditions, anything that could make an impact on your quality improvement project. You also need to look at your staff. Is there going to be participation? Is there low morale? Things like that can affect the overall project. Data collection is huge for quality improvement. It's a good idea to possibly delegate staff members to collect data, and then as a team you can analyze this data and help determine an overall goal for your QI project. Once you've analyzed your data, another important step of all QI models is to communicate your results. If you don't do this, people won't understand why the project was done in the first place. After this is done, you need to take ownership of your project, be proud of your results and success, and look to the future to see what other projects you can tackle in your future for your practice to continue improvement. In regards to the FADE model, F stands for focus. We need to define the process that we're aiming to improve. A stands for analyze, which means prepare and examine data to find causes and then ultimately finding solutions. You can delegate members of a committee to do this for you. You can have them give ideas as to why they think the problem is occurring. The next step is D for develop. We're going to develop plans for improvement, and within this we're going to measure, implement, and communicate. Next is execute. This involves figuring out the plan that you want to use and going forth with your staff members to complete your task. This is just a really great image that helps break down the FADE model and gives you some imagery to help realize every step of the way. You can see under focus, it's really good to make a list of problems and then kind of narrow that list down into the problem that you're going to focus on for your quality improvement project. Then moving forward to analyze, you're going to decide what specifically about that problem are you trying to understand. Then you're going to delegate members to collect data and get a baseline going forth in your project. And then you're going to determine what's influencing that problem to continue happening and how we can change that. Then together as a team, you're able to develop a plan to help solve the problem that you initially identified. After you've got your plan in place, you can establish team members to execute your plan and continue to monitor the effects of your plan and record your impact. Quality improvement is essential in the primary care setting. FADE and other quality improvement models could be used to manage things like excessive wait times, patient flow through the office, lack of proper patient education, poor follow-up rates, an effort to reduce no-show appointments, ultimately increasing revenue, and other things such as screenings for cervical, breast, colorectal cancer, and maybe even access to evening, weekend, and holiday office visits. A good example of a quality improvement project is Ellen Davis's study, A Quality Improvement Project in Diabetes Patient Education, in the year 2000 from the journal Diabetes Spectrum. The ultimate goal of the survey was to optimize diabetic education to patients, especially those 65 and older. A QI survey tool was used to analyze the current level of diabetes education provided. A standard diabetes teaching protocol was then implemented, and the outcome showed that test scores were slightly better than pre-protocol implementation survey scores. To break down this study by acknowledging the FADE model, the focus was the 17% of patients who were diabetic. Looking into the Analyze section, staff analyzed the current level of diabetes education provided using a quality improvement survey tool. The study revealed that the staff offered education less frequently to people over age 65. Next, staff developed a diabetes teaching protocol that would be standardized by staff. 6 months later, staff re-executed those same QI survey tools to measure progress. Ultimately, fewer patients had received self-management education. Test scores were slightly better than pre-protocol implementation surveys.